Hi, Hadley.
Hi, IJ.
I'm IJ. I'm a ward manager and a registered nurse at Homerton Hospital. I wonder if you could tell me more about call for concern and what it is.
Of course. So I'm one of the nurses on the critical care outreach team, also known as CCOT. We are a senior nurse-led team that is responsible for responding to acutely unwell patients admitted throughout the hospital. Call for concern is a way patients or their relatives can escalate their concerns directly to us. If they think the patient is acutely unwell or getting worse and worried about what isn't happening, then they can call CCOT on the call for concern mobile number, which is 0755 715 7464.
Okay.
We will then review the patient and liaise with the team looking after them about the situation.
That sounds really great. But wouldn't the team looking after them already know what's happening?
Yes, but call for concern is activated when the patient or their relatives are concerned about clinical deterioration despite this.
Okay.
They know the patient best and they can tell when something isn't quite right. If the ward team have already tried to address this, but the patient is still worried, we are able to provide a fresh pair of eyes to assess the situation and check in with the team that everyone is on the same page. That way, we can work together and move forwards. We also want to reassure patients not to feel worried that using this service will negatively affect their care or their relationship with the ward team in any way. It won't undermine the team treating them. We're all just here to help.
Okay. Would patients be able to call CCOT at any time of the day?
Yes, we operate call for concern 24 hours a day, 7 days a week. It is for all patients admitted to the hospital, including neonatal, pediatric, adult, and maternity patients. It is not for outpatients. Patients and relatives call via mobile and can get straight through to us. We will ask for the patient's name and date of birth, what ward they're on, and a brief description of the problem. Sometimes we aren't always able to immediately take the call, but the caller can leave a message with the same information along with a contact number, and we will call them back as soon as we can. We also triage call for concern calls alongside our own workloads in order of clinical urgency.
I see. It sounds like a great service. Are Homerton the only hospital running it?
We're not the only ones. It is now an NHS England mandate, so hospitals up and down the country will be rolling this out. There are some hospitals who have been running this service for years, and we know a lot of information from them already. We know call for concern can help by simply explaining what the usual process is in a hospital. For example, how a ward runs, who some members of staff are, explain reasons for scans and tests, and make sure that patients are being communicated to clearly and by the right people.
Wow. It sounds like it will help alleviate a lot of people's worries. Aren't you going to be inundated with calls?
Well, we won't know exactly how many calls to expect until we run it. We encourage all patients and relatives to raise queries to the team that are looking after them on the wards, as a lot of things can be resolved that way. I know it can be hard when visiting in the evenings or when you're not always able to get hold of the right person for an update. I suppose it's important to say that this is used to raise concerns about acute deterioration and it isn't a complaints line. For example, call for concern isn't for issues around parking, food, appointments, visitation, or waiting times. We will redirect those calls to the appropriate people, like the nurse in charge, the ward managers, PALS, or the complaints team. We would like to use the time to focus on unwell patients instead.
Okay. So, how can patients and relatives find out more information about it?
There are lots of posters and leaflets around the wards with the call for concern mobile number on it. The patient leaflet also has a QR code which leads to the Call for Concern website.
What about those that don't speak English or can't speak, or those who don't have relatives visiting?
The patient leaflet is translated into several different languages on the website. For those who can't advocate for themselves through speech or don't have relatives, it's up to the staff individually to advocate for those patients. We do this every day anyway, when we are looking after patients and assessing how they communicate. It is rare, but staff can also call for concern on the patient's behalf.
Okay, so what about your thoughts about call for concern as the CCOT team running the service?
I think this is a great opportunity for us to hear the patient's voice and improve our own monitoring of deteriorating patients across the hospital. Whatever challenges that do come up, we have a fantastic team to deal with it and learn from whatever arises.
Great, sounds great. Thank you so much for explaining call for concern, Hadley. I'm looking forward to hearing about the ways we can improve patient care.